Surgeons, what was your oh shit moment? Male story 1, I scrubbed in like any other day, prepped and focused. The corneal transplant was routine, or as routine as peeling off and replacing the window to someone's soul could be. Everything was laid out just right. The donor cornea ready. Sutures finer than spider silk waiting on their sterile tray. The patient, a middle-aged woman, lay draped on the table. Her vitals had been steady, her demeanor calm. The anesthesiologist gave me a thumbs up. We were good to go. The scalpel slipped through the layers of her cornea cleanly, like slicing the skin of a grape. With careful hands, I removed the cloudy, damaged tissue, setting it aside. Now, the eye lay exposed, a glistening, fluid-filled void. I paused just a second to admire the delicate anatomy, the tear film shimmering under the lights. Then her stomach lurched. The sound of retching hit first, a guttural heave followed by the wet gag of impending disaster. Her body convulsed, chest rising sharply, and with it chaos. Vomit surged up, her head jolting against the restraints, and in that moment, her eye, wide open, unprotected, became the stuff of nightmares. Everything inside the eye threatened to spill out. I froze, one hand hovering over the surgical field. My brain screamed, "Move!" The room buzzed as the scrub nurse tried to suction bile from her mouth. The anesthesiologist barked something about airway management. None of it mattered. My world shrank to that one eye. No cornea, no barrier, nothing but raw vulnerability between her and permanent blindness. I snatched the donor cornea from the tray, hands trembling. Every stitch had to be perfect, but there was no time for perfection. Vomit still came in waves, her body jerking beneath my tools. The sutures, finer than a strand of hair, slipped and snagged. I cursed silently, weaving the needle faster than I thought possible, praying the tissue would hold. Minutes stretched into eternity. Sweat dripped into my mask, my shoulders locked in tension. Finally, I tied the last suture. The eye was sealed, though far from pristine. The aftermath was ugly, but functional. When the patient stabilized, I peeled off my gloves and slumped into a chair. No one in the room spoke. We didn't need to. That day, I learned 2 things. Always prepare for chaos and trust no one who says they skipped breakfast. Male story 2, the call came through at 2 a.m., jerking me awake. General surgery, they said. Vague, but I was used to it. Nights like these, you brace for the worst and hope for the mundane. I rolled out of bed, threw on scrubs, and drove through quiet streets to the hospital. Details trickled in as I arrived. Parectal abscess. Lovely. Down in the ER, the nurse handed me the chart and smirked. Have fun. Never good. The patient, a 314-pound woman, was writhing on the stretcher. She muttered Hail Marys and yanked at her hospital gown, her pain turning the ride to the OR into a chaotic mess. In the OR, we prepped fast. She went under anesthesia after a struggle, and we got her legs in the stirrups. The infection looked bad, red, angry, seeping pus, but nothing out of the ordinary for IV drug users like her. We suspected the dirty needles she'd been using in her perineum had caused the infection. Standard procedure, right? The surgeon made the first incision, the tiniest cut, and then it hit. A geyser of hell. Pus, rotting tissue, and liquid feces erupted like a volcano with nowhere else to go. It hit the surgeon dead center and sprayed outward, coating the walls and floor. The smell was immediate and vile, thick, and putrid enough to taste. I froze, my eyes locked on the surgeon as he staggered back. He was drenched from chest to knees. The torrent kept coming, triggered by every twitch of her muscles. It spread across the floor in a creeping pool of filth. The other nurse gagged, then ripped her mask off and bolted from the room, retching into a sink. I made a break for the supply room, desperate for the bottle of peppermint oil we keep for disasters like this. Empty, someone had used it all. I grabbed Mastisol adhesive instead and rubbed it inside my mask, praying for relief. It barely helped. Back in the OR, the surgeon soldiered on, ankle deep in sludge, carving away necrotic tissue while the smell burned our throats and stung our eyes. When we finally finished, I peeled off my soiled gown and scrubbed myself with alcohol in the locker room. My skin stung, but I'd take the burn over that stench. By morning, the OR still reeked, the floor glistened with residue, and the housekeepers cursed our names. Male story 3, the operating room buzzed with its usual symphony, metal clinking, machines humming, and the soft shuffle of sneakers on polished floors. I was a med student back then, standing awkwardly at the edge of the room, trying to stay out of the room, trying to stay out of the way while absorbing everything. The air carried that sterile tang of disinfectant and sharp focus. The patient, an older guy with a wiry frame, lay on the table, eyes darting around as the team prepped him for surgery. The anesthetist leaned over him, mask in hand. The needle went in smooth, the kind of practiced motion I could only dream of mastering someday. Monitors beeped in rhythm and the patient's breathing slowed. The nurse glanced at the screen, nodded, and said, "Okay, he's out." Everyone shifted gears. Gloves snapped, instruments were laid out, and the surgeon positioned himself with that quiet, commanding presence they all seemed to have. The scalpel hovered above the patient's skin, the blade catching the harsh overhead light. My eyes locked on it, nerves jangling like I was the one about to get cut open. And then the patient moved. Not much, just a small tilt of the head, side to side, like he was saying no to a bad idea. The surgeon froze mid-motion. Everyone else stood there, stunned, like statues caught in an earthquake. And then, in the smallest, weakest voice, the patient muttered, "No, I'm not out yet." The anesthetist jolted forward, fumbling with the mask. The nurse let out this awkward half laugh, half gasp, like her brain couldn't decide whether to panic or find it funny. The surgeon let out a breath and stepped back, shaking his head as if to clear it. I swear even the monitors seemed to pause, their steady beeps momentarily holding their breath. Once they got him fully under, the atmosphere relaxed again. Someone muttered something about close calls, but the tension lingered like a ghost in the room. The rest of the procedure went smoothly, but that moment stuck. The thought of what could happen if that patient hadn't found the strength to move chilled me. Later, standing in the scrub room, I could still hear his faint voice cutting through the hum of machines like a warning. "No, I'm not out yet." Male story 4, the room smelled like antiseptic and sweat. The kind of cocktail that clings to your scrubs after hours of standing under the bright surgical lights. My hands stayed steady, gloved fingers hovering as the attending guided me through the most intricate surgery I'd ever touched. The patient's abdomen was splayed open like a meticulously folded book, every vessel and organ positioned in stark relief against the sterile drapes. The tumor was monstrous, 15 centimeters of malevolence, its grip extending into the vena cava like some sinister vine. The sheer scale of it felt obscene, as though it didn't belong in a living human being. We worked in silence, the only sounds the beep of monitors and the rhythmic hiss of the ventilator. Scalpel here, suction there. Instruments passed seamlessly, our unspoken rhythm honed through repetition. The vena cava lay exposed, throbbing faintly with life. I could feel the tumor thrombus with my fingertips, solid and unyielding, as though taunting me. My brain raced through the playbook. Clamp, cut, and pray the patient doesn't bleed out. My mouth stayed shut, though, as the attending shifted beside me, his confidence palpable. And then he did something that I didn't expect. His hands, precise and deliberate, wrapped around the vena cava. He squeezed, not harshly, more like coaxing toothpaste from a tube. I held my breath as the thrombus started to budge, sliding backward toward the renal vein. It was surreal, like watching a stubborn cork finally pop loose. I didn't hesitate. Sutures ready, I worked to tie off the renal vein with the efficiency of muscle memory. My fingers moved as if they'd been rehearsing this exact moment for years. Blood loss stayed minimal. The tumor remained corralled right where it needed to be. The clamps came off and the vena cava pulsed again, unencumbered. Closing up felt like wrapping a gift, every layer neatly stitched, every detail double checked. By the time we rolled the patient to recovery, my back ached and my shoulders burned, but I didn't care. 4 days later, she walked out of the hospital, a fresh scar and a new lease on life. That night, washing the crusted blood from my forearms, I didn't feel tired. I felt like a surgeon. Female story 5, the OR lights burn bright, unforgiving. I remember lying there, tethered to the table like a ship to its moorings. The air was sterile, a metallic tang filling my nose. I had no sense of time anymore. 28 hours of labor had dissolved it, and 6 hours of pushing had ground it into dust. But I knew something was wrong when the midwife froze. Her gloved hand came up, smeared in blood, and she snapped into motion like a rubber band released. We're going to the OR now, she said, brisk but deliberate. My body was leaden, but my brain reeled. Shock painted the world in muted colors. I was being wheeled down a hallway before the words fully hit me. In the OR, bodies in scrubs swarmed, their movements sharp and purposeful. Someone tugged at my arm, strapping them down. A mask came over my face. The last thing I remember before the haze was hearing one of the surgeons say, 8 minutes. It felt like a countdown. Then came the oh shit, clear as day, cutting through the muted hum of machines and muted voices. I wasn't supposed to be awake enough to hear that, was I? It was the kind of phrase that could halt anyone's heart. Not the words you expect from a surgeon opening you up. I heard the urgency in their voices, but couldn't piece together the meaning. They mentioned blood in the catheter bag. They said something about my uterus being torn. I wanted to scream or move, but my body didn't belong to me anymore. They worked fast. I remember the absence of sound first, the moment of absolute silence when my son entered the world, then the smallest noise, a gurgle, a whimper. It stretched like an ocean, the moments between that and his first full-throated cry. When I woke, my body felt like a battlefield. The doctor came in, their face a mix of relief and exhaustion. They explained the rupture, the timing, how my son had been trying to force his way through the uterine wall. 15 minutes. That's all I'd had before the worst could have happened. Later, I Googled it. A ruptured uterus isn't just rare, it's a life and death roll of the dice. But somehow we'd rolled a win. DRS and the team pulled us back from an edge I didn't even realize we were teetering on. My son was perfect. I was alive. The rest was detailed. Male story 6, the delivery room buzzed with the kind of tension you can feel in your teeth. The monitors beeped steadily, the midwife hovered, and the dad clutched his partner's hand like it was the only thing keeping him upright. This poor woman had been laboring for hours, her body exhausted. The decision had been made. Time for a C-section. I made the incision, neat and practiced, exposing the uterus. A few more precise movements and I had access to the baby. Everything seemed textbook until it didn't. The baby was wedged in tighter than I'd expected, like they had no plans to leave their cozy nook. The assistant applied pressure to the fundus, pushing from above to help ease the baby out. It was standard procedure, nothing weird. Until it was. One extra push, and suddenly there was this sloshing, slippery whoosh. The baby shot out like a greased torpedo, slick with vernix. The tiny body hit the sterile drape, skimming across it like they'd been launched from a water slide. For a heartbeat, everyone froze, watching the absurd trajectory. The registrar moved fast, reaching out instinctively. His gloved hand snagged the baby's ankle, snapping them mid-air. Relief flooded the room for about half a second. The baby was so slippery that they nearly wriggled free again. His grip slowed, slipped, and I swear time slowed as the baby flailed, flopping like a fish about to escape into thin air. The midwife didn't miss a beat. She lunged forward, towel at the ready, catching the baby as they tumbled downward. The room exhaled all at once. She wrapped the little one quickly, securing them like a burrito, and handed them over to the waiting pediatric team. The baby, to their credit, let out an angry wail, letting everyone know they were perfectly fine, if a bit offended by the chaotic welcome. The parents didn't bat an eye, clearly assuming this was all part of the show. Meanwhile, I locked eyes with the registrar. His face mirrored my own, a mix of horror, disbelief, and the silent agreement to never speak of this again. As the surgical site was closed and the room settled, I still couldn't shake the image of that slippery little rocket hurtling across the drape. 1 second longer, one misgrab, it didn't bear thinking about. Male story 7, the fixator was a beast. I was a kid, but even then, I knew it was more metal than anyone should have screwed into their leg. 3 rings, rods, anchoring it like a medieval torture device, and that horseshoe thing hugging my ankle, tight, invasive, and inescapable. It wasn't just there to look terrifying. It was supposed to realign my ankle, which had been mangled by a birth defect they called talipstall, fancy name for a foot that just didn't work right. 9 hours on the table, and they put me back together with enough hardware to stop my own construction site. The doctor, a man with a reputation for loving his own brilliance, seemed pretty pleased when he saw his work post-op. He strutted around the recovery room, pointing at the contraption and nodding like he'd built the Eiffel Tower. Then he paused. He leaned in, squinting at the pins, those colored numbered ones that my dad was supposed to adjust daily, like tuning a tiny, horrifying violin. His hand went to his forehead, then slid down his face. I'll never forget his muttered "shit" under his breath. It wasn't loud, but it hung in the air like the smell of antiseptic. He'd messed up. The numbers, the alignment, the very logic of his grand design, it didn't add up. He moved back and forth, tracing the pins with his fingers like they were cursed. I could see the mental math spinning in his head. My leg, his magnum opus, might have been scrambled. He caught himself, though, adjusted a few numbers, shuffled the sequence. Crisis averted, or so it seemed. 6 months of living with that contraption, pins threaded through flesh and bone, and I endured it. The goal was simple: walk better, fix the foot, avoid the wheelchair. But you hit the nail on the head there for sure. But the cage came off, and nothing had changed. No smooth step, no miraculous straightening. A year later, I sat down with my parents and said it plain. The leg wasn't cutting it. They took it, and suddenly everything worked. A prosthetic, some grit, and I was moving like I never moved before. The surgery didn't fail, it just didn't know where it was headed. Running beats walking any day. Female story 8. It started as just another shift, or so I thought. The ICU hummed with the usual mix of monitors beeping and muted conversations. I came in to find a new admit. Intubated, sedated, with tubes snaking out of every orifice imaginable. By mid-morning, though, he was extubated and clear-eyed, a miracle of modern medicine. The guy was in his late 30s, an end-stage renal patient who'd long since stopped making urine. The Foley catheter? He wanted it out. Said it hurt, and honestly, with an empty bag all shift, it seemed pointless to keep it in. The hospital policy was clear. I didn't need a doctor's green light to remove it, just no standing orders against it. There weren't any. So I grabbed the kit, deflated the balloon with a practiced twist, and slid it out. What followed, though, I'll never unsee it. The second the catheter cleared his urethra, blood erupted like a broken dam. Thick, dark red, gushing with alarming force. My brain raced to connect the dots, even as my hands flew to contain the mess. The Foley had been misplaced, balloon inflated too soon, tearing up his urethra from the inside. I was holding a literal faucet of blood. Instinct kicked in. I clamped his penis shut with both hands, gripping tight enough to make my knuckles ache. Pressure, I knew, was my only ally until help arrived. Across the room, my coworker paged to the resident while I stood there, my hands slick and sticky, trying to stanch the flow. Blood pooled on the sheets, dripping off the edges of the bed and onto my shoes. My scrubs were soaked. Minutes stretched like hours. When the resident finally appeared, his face screamed sympathy and helplessness. Just keep holding, he said, and left to summon urology. So I did. For 60 grueling minutes, I held this man's penis in my hands, gripping and pressing, trying to ignore the warmth of his blood and the way it seeped between my fingers. Polite conversation became a lifeline. We talked about sports, his favorite shows, anything to distract from the grotesque intimacy of the situation. Every time I eased off to check, the blood poured anew, relentless and punishing. When the urologist arrived, I stepped back, arms trembling, drenched in crimson. I felt like I'd wrestled a demon and barely won. The room smelt like iron and sweat. The sheets, the bed, my uniform, everything looked like a crime scene. Just another day in the ICU.